and welcome to Apollo Hospitals Presents Healers of India. On this series, we are putting the spotlight on those individuals and organizations who are spearheading efforts to improve rural healthcare in India. On the show today, our first story is taking us to the heart of Jharkhand, where Asha workers, or Sahiyas as they are locally known, are providing a ray of hope to rural mothers. 10 months ago, when Ankit was born, his mother's joy knew no bounds. But that joy was short-lived. Ankit was soon down with hypothermia, and in the remote location of Seraikela in Jharkhand, there was no immediate healthcare available.
The baby was 20 days old. It was an overcast day. I bathed the baby for a bit long. He soon caught cold and was not breathing and taking feed.
That is when the true importance of the village health worker, or Sahiya as she's called, came to the fore. Anju, a health worker trained under the American India Foundation's Mansi program, stepped in to take control of the situation with her expertise and saved Ankit's life.
Didi came and wrapped the baby with a shawl. She kept the baby close to my chest. Slowly he warmed up and started taking feed. Then Didi took us to the doctor, where we were informed that the baby was fine.
At the last mile, the need for improvement in neonatal and maternal health care was long desired. In particular, the young state of Jharkhand, with a majority of tribal population, was reeling under the burden of high infant and maternal mortality rates. Project Mansi was launched to transform this scenario. Mansi is an unprecedented public-private partnership between American India Foundation, the Jharkhand State Government, Tata Steel, and the NGO Surge. The initiative is empowering frontline health workers, or Sahiyas, through training and low-cost technological interventions, leading to significant improvement in saving the lives of newborn children and new mothers in the region.
Mansi stands for Maternal and Neonatal Survival Initiative. It was AIF which had thought about such a project, and we wanted to have the project implementation in a collaborative manner under a public-private partnership mode. So AIF approached Tata Steel to collaborate under the corporate social responsibility. Then we had Search, whom we approached to provide us the technical support, and then we approached the government. So advocacy was a key role of AIF to bring in the partners together.
One of the most prestigious corporate houses, Tata Steel, has always been a major contributor towards uplifting the rural poor. Under its corporate social responsibility initiatives, Tata Steel contributes towards implementation of community-level activities and clinical outreach for Project Mansi. It also ensures that the health workers' need for infrastructure is fulfilled.
When we started this Mansi project, we took one block in Jharkhand, which was Seraikela, which had really appalling numbers in terms of infant mortality. What we tried to do in this is try to bring the best practices of business management to solve some of India's social problems. We borrowed from the Search Gadchiroli model, and we trained the Asha Didi in Jharkhand. They are called Sahiyas, and we trained them on managing some of the major causes of infant deaths.
Under the leadership of the Jharkhand State Government that provides key support in implementation and monitoring of the program, Project Mansi was launched in Seraikela, providing coverage to nearly 83,000 residents in 167 villages.
आशा को हम लोग यहाँ nomenclature हमारे यहाँ सहिया है.
Nomenclature of Asha is Sahiya here in the state. They are the link between the people and healthcare providers.
इस कड़ी को first of all उसके
We have trained them on how to identify diseases in newborn babies and mothers.
बच्चों में अगर कोई
They are now well equipped to treat high-risk pregnancies and malnutrition.
कैसे आप आइडेंटिफाई कीजिएगा?
We have further extended the initiative to cover the entire district.
उसमें रिक्वेस्ट आया और सब लोग मिल के इसको हम लोग एक्सटेंड किए पूरे डिस्ट्रिक्ट में.
The training of the SAYAs and technical support for implementation of the program is provided by the NGO Search. Health workers are trained in best practices and tried and tested techniques of search to handle the most complicated cases at remote locations. The SAYAs are thoroughly monitored during the training by AIF and also encouraged to share practical case studies amongst themselves during group meetings. This has significantly improved the knowledge as well as the social status of the health workers in their respective villages. The SAYAs are not only seen as healthcare providers, but are also respected as wise women of the villages.
We visit expected mothers and register them at Anganwadis. We provide them vaccination. We treat both newborn babies and mothers. We got training through Mansi. We learned various techniques of neonatal care as well as how to take care of malnourishment.
कैसे देखभाल करना है उसको भी हम लोग सीखे हैं गांव के लोगों से.
We get very good response from locals. People have become friendly with us and ask about our well-being. We feel elated by the warmth they show us. Everybody in the village now respects our work.
और कोई भी मतलब हमको अभी बहुत सम्मान देते हैं गांव में.
With proper hand-holding from AIF, the health workers have become apt at resolving complicated cases at the first level of contact with patients. Minutes after his birth, Prem stopped breathing while his mother slipped into unconsciousness. The lives of both mother and son were minutes away from being extinguished. The village Saya then performed a life-saving mucus extraction on Prem and brought his mother back to life as well.
After birth, my child was not responding. Didi came and used apparatus for mucus extraction. After treatment, the baby came to life and it was a big relief for us.
Numerous such success stories are testament to the improving healthcare services and declining infant and maternal mortality rates in the remote villages of Jharkhand. In the near future, AIF, along with other key stakeholders of Project Mansi, aims to scale up the program to cover 1,447 villages in the second phase and subsequently the entire state. The success of Project Mansi is testimony to the collaborative efforts of public and private players coming together and making a considerable difference to rural healthcare. Let's take a short break at this point. On the other side, we'll bring you the story of a man whose innovation is saving thousands of children from death and disability. Stay with us on Apollo Hospitals presents Healers of India. Welcome back to Apollo Hospitals presents Healers of India. Our next story today is a tale of simple yet powerful ingenuity where a doctor has harnessed the reach of the ubiquitous mobile phone to save the lives of lakhs of children across India. Watch how a simple innovation can leave an astounding impact. India loses over 2 million children under the age of 5 every year. Another 1 million or more are disabled for life. A major contributing cause for this tragedy is the fact that parents often forget to get their children vaccinated on time.
The challenge of educating the people of India about immunization is a very massive one. Ours is a unique country with 1.2 billion population and more than 16 official languages. So, we can understand what the challenge is to educate them about the various aspects in various languages, in various ways that they can understand. We have people across all socio-economic status, and our message and our health education should suit the needs of all of them. So it is a very big challenge indeed.
When distressed mothers approached Dr. Ranjan Pejawar feeling guilty for having missed their children's vaccinations, an idea struck him. Together with his team, he developed Immunize India, a free-of-cost, nationwide, personalized SMS alert system that reminds parents to get their children vaccinated at the right time.
Immunize India is a project or program which stemmed from real life situations. It is the agonies with which the mothers used to come to my clinic if they delay immunization or miss a immunization prompted us to think of this Immunize India project. Immunize India project in India is run by Indian Academy of Pediatrics, that is the professional body which has more than 25,000 members. They have endorsed it and they are promoting it, and they are helping us with the project in India.
Parents can register for this free service by simply sending an SMS with their baby's name and date of birth to the short code 566778. Thereafter, 3 reminders are sent at 2-day intervals for each vaccination that is due. These reminders are sent to the registered phone number for 12 years as per the IAPCOI prescribed immunization schedule. Vaccination reminder services in several countries have been effective in increasing compliance by 20%, and Dr. Pejawar believes they can have an impact in India too.
One text message will ensure that the phone, the cell phone from which it was sent, will receive immunization alerts 2 times in the week when the immunization is due, and this is for a period of 12 years, which covers almost all the childhood vaccines. Also, this is free of cost and it is available in every nook and corner of India across all telephone operators.
Leveraging the potential of over 1 billion mobile phones in use in the country, a well-promoted national text message reminder service is one of the most cost-effective methods of reminding parents that a vaccination is due.
We are very proud to say that as of today, we have 1.5 million registrations. The short-term goal is to reach a registration total of 5 million by 2020. However, my personal feeling is that I will be happy and satisfied when each and every child or baby who is born is registered in the Immunize India project.
With 1.5 million registrations till date, the IAP Immunize India program has set its sight to prevent 100,000 child deaths and disabilities by the year 2020. Well, it's time to take another short break right now. On the other side, we'll bring you the inspiring story of another healthcare hero who left his home in Aligarh to move to a Naxalite area to serve the needy. Stay with us on Apollo Hospitals presents Healers of India. Welcome back to Apollo Hospitals presents Healers of India. Our final story today comes from the Bijapur district in Chhattisgarh, where doctors from many different parts of the country are coming in to serve the medically deprived tribal population. Let's take a look at the impact and the transformation that they are bringing about. More than 9 hours is what it takes for locals to reach a medical specialist in Chhattisgarh's Bijapur district, where last-mile connectivity is still far from reality. In a state known for its high maternal mortality rate, the road to reach a doctor is not an easy one for expectant mothers. The Bijapur District Hospital is the primary health stop for locals in this area, and recent additions to the hospital's gynecology department have come as a boon to the women in the region.
Earlier, even if they make a call, there was no ambulance to reach. If by somehow the ambulance reached there and we were able to bring the patient even to the district hospital of Bijapur, there were no doctors to treat them. But today things have improved. In the hospital, there are people who can take care of the patient and have at least the preliminary treatment being made available.
15 medical practitioners from outside the region have moved in to serve the tribals in far-flung areas of Chhattisgarh. This is part of the state government's latest initiative to bring specialized healthcare to the area in partnership with the Public Health Foundation of India.
It was a very welcoming step that UNICEF thought that if first referral units start in these districts, then they would be saving a lot of lives of children and mother who could be dying otherwise. So the state, the UNICEF and Public Health Foundation of India started this initiative.
This program by the state government in association with PHFI is being pegged as a game changer for rural healthcare in Chhattisgarh. The state government is reaching out to accommodate families of doctors in a bid to retain their services in remote areas. The aim is to provide continuous and undisrupted specialized medical care to locals, and for this, attempts are being made to fill up the vacancies at various health centers across rural Chhattisgarh.
We are making more efforts with more flexibility and better amenities in terms of infrastructure for staying, officers club, in terms of better educational facilities and educational institutions. So we are facilitating the process. What we are offering here is the work experience and a different lifestyle altogether.
28-year-old Arun Chaudhary is the latest addition to the Bijapur District Hospital. Arun's arrival at the hospital made the gynecology department fully functional, and he has already spearheaded many life-saving surgeries.
9 July को मेरा first day था जब मैं बस
On my first day at the hospital, a patient of obstructed labor came, but there were no facilities available for her treatment.
मतलब ये facility available नहीं थी क्योंकि कोई डॉक्टर नहीं था करने वाला. बहुत बुरी हालत में आई थी patient. तो हमने उसे
She was in a very bad state.
मदर को stable किया. उसके बाद इंजेक्शन सिंटोसिनोन जो कि दर्द बढ़ाने के लिए दिया जाता है.
We hydrated her, gave her injection to induce labor pain. Then we encouraged the mother and helped her to deliver the baby.
माँ ने बियर डाउन किया, थोड़ा हमने सपोर्ट देके फिर बेबी को डिलीवर आउट कराया, फिर बेबी को रिससिटेट किया.
Now there's a reliable destination where women can get their health checkups done regularly. Apart from increased doctor visits, Arun's arrival has also increased the awareness of maternal health issues amongst the locals in Bijapur.
यहाँ अभी मतलब बहुत कुछ पसंद है, साफ सफाई.
The facilities here are really good. Doctors take good care of us.
बार-बार आकर देखते हैं, चेकअप कराते हैं, मतलब करते हैं, तो अच्छा लगता है.
While the scheme addresses the challenge of keeping family members of doctors with them in remote areas, for Arun, being a male gynecologist is the biggest challenge he faces in rural India.
Gynecologist के नाम पे लोग फीमेल चाहते हैं और
generally patients prefer female gynecologists.
फीमेल को दिखाना है, पर धीरे-धीरे माहौल चेंज.
But now, with changing times, patients have become comfortable. Now, only 1 out of 10 patients feels uncomfortable. If the patient feels uncomfortable, I don't examine her.
अगर पेशेंट रिफ्यूज कर रही है तो हम नहीं देखते हैं. और the dictum के मतलब medical ethics में.
As per medical ethics, it is mandatory to have a female nurse present during examination by a male gynecologist. So, we keep a female nurse during examination of the patients.
Female nurse के होते हुए patient convinced रहती है.
As Arun continues his stint in Bijapur, Chhattisgarh, there is hope that there will be many like him who will give their time and expertise to serve those in remote areas. This initiative stands as a model to provide last-mile health connectivity that offers hopes of good health to India's rural poor. Well, hope you enjoyed those stories of grit and determination that are really transforming rural healthcare in India. There are hundreds of such individuals and organizations out there who are doing some stellar work in the remotest corners of our country. So if you know of any such healers of India who are making healthcare affordable and accessible to all, do write in to us about them. Hope you enjoyed this special show. Apollo Hospitals presents Healers of India. Until next time, it's goodbye.